Continue. Our next entity is juvenile granulosa cell tumor. From the name juvenile, we already know the mean age should be much younger than the adult type. And there is a phenomenon called the isosexual pseudo precocity. What does that mean? Why we call it pseudo? So if not pseudo, that is the true precocity. That means our sex development, like our breast, penis, and or other hair, we will get mature in the true precocity, as well as our ovary and testicle. However, when in this tumor, the patient had this pseudo precocity. That means we have the outside manifestation, like the breast, maybe the penis, and then some hair follicles, our hair, but in the testicle and the ovary still immature. Then the related symptom is about amenorrhea or menstrual irregularity. But the prognosis is really good, 5 years survival rate is more than 90%. It may be associated with earlier disease or Maffucci syndrome. The gene related to Maffucci syndrome, that is the IDH gene, it also relates. In this syndrome, you may find anchordoma and some hemangioma, especially spindle cell hemangioma, because IDH1 or 2 mutation also the driver mutation in spindle cell hemangioma. So just bear in mind. This is the growth picture of juvenile granulosa cell tumor. You can see this yellow nodule is the tumor in the ovary. The microscopic feature also, the architecture is really similar to the adult type granulosa cell tumor. That means you could not find really distinct, definite diagnosis pattern. They can form solid and follicular and also multinodular growth. But their follicle just vary in size compared to uniform microfollicle in an adult type granulosa cell tumor. Then the cytoplasm is really characteristic. Eosinophilia is not that good, but you can see really characteristic clear bubbly cytoplasm in juvenile type granulosa cell tumor compared to just eosinophilia, no bubble, no clear cytoplasm in the adult type granulosa cell tumor. So this is the multinodular pattern of the juvenile granulosa cell tumor. Then this is the follicle growth pattern, but you can see this follicle has different shape, different size. So compared to the uniform size in adult type granulosa cell tumor. And then here show you really characteristic, a little bit nuclei you can see, but no nuclear groove. And then cytoplasm is really characteristic, this clearing and even bubbly cytoplasm. And then the cytoplasm is more abundant than the adult type granulosa cell tumor. So bubbly, clear cytoplasm, no nuclear groove. The tumor cell also can grow around this follicle cyst wall, and then more apoptotic bile in this juvenile type granulosa cell tumor. The differential diagnosis including small cell carcinoma, hypercalcemia type. I do not have a picture here, but you can read this entity after this lecture by yourself, or maybe later I can make a lecture for the small cell carcinoma, but not right now. You just need to remember SMARCA4 expression. Loss of SMARCA4 is the characteristic marker for this entity. Then adult granulosa cell tumor, I already mentioned the patient should be older, coaxial body, and then the follicle is more uniform shape and size, but more regular in size and shape, but in the juvenile one, we have different shape and different size of follicle. And then nuclear groove is characteristic for adult type, and lack of apoptotic body, and FOXL2 mutation. Of course, sarcoma always in our differential, but it has grayish abundant cytoplasm, syncytial growth of the cytoplasm, and this reticulin staining is really characteristic, and no follicle structure. So let's go to see some virtual slide. This is the juvenile time granulosa cell tumor. Even in this low power, really catch your eyes is a different size of space. That is the follicular or cystic structure. You can see different size of shape. Really different from the adult time granulosa cell tumor. And then we can zoom in, we could not see coaxial body. And then zoom more, you can see this clearing, bubbly cytoplasm and more abundant than the granulosa cell tumor. So this feature is characteristic. You can always bear in mind different shapes and size of the cystic or follicle structure, no axonal body, no nuclear groove, and this characteristic clear bubbly cytoplasm and more abundant cytoplasm. This is maybe a mitosis figure. You can see some dirty background. That is the apoptotic body. I don't want to find more apoptotic body for you, but just show you this clear cytoplasm, really characteristic. This is a multinodular growth pattern of juvenile granulosa cell tumor. Even in this really low power, you can see different types or shapes of follicle. So you know, this should not be classic pattern for the adult type granulosa cell tumor. Should be juvenile type. Then no coaxial body, and then really this empty space around the cell, clear cytoplasm, bubbly cytoplasm, no nuclear groove. That is the juvenile granulosa cell tumor. See, this is absolutely not coaxial body. This one also forming even like pseudo lipoblast looking cell. Different shapes and size of this follicle cystic structure. Here is cytoplasm, bubbly cytoplasm, not really uniform for the cell. I can just show you real quick for the adult type. You can see when you contrast these two, just the cytoplasm you won't forget. See this really minimum cytoplasm, eosinophilic, no this empty space, no this bubbly coaxial body. Okay, let's see our summaries.